This is Dr. Sinnonhyeon from Pleasure Plastic Surgery. One of the surgeries I've been performing very frequently these days is called Alar base elevation. I think there are quite a few people who aren't even aware that this surgery exists, but honestly, even I didn't expect that so many people would want this surgery until I started performing it myself. Let me briefly explain what Alar base elevation is. If you look, sometimes the alar base droops down, so from the side the nostrils are barely visible and the nose can look stuffy. In more severe cases, when viewed from the front, the alar base droops in a triangular shape, which can make the nose look awkward and stuffy just by looking at it. In such cases, if you lift the alar base upward like this, it gives a fresher and more natural impression, whether viewed from the side or the front. Today, what I actually want to talk about is a kind of variation of this alar base lift, you could say. I'd like to talk a bit about the effects of this modified alar base lift surgery. Among the people who come to our clinic, of course, the majority come specifically to have this part of the alar base lifted, but there are also many who come seeking additional effects. That's why we've prepared this video. First of all, in most cases, there are actually quite a lot of people who want to lift not just the alar base itself, but specifically the lower part of the base on both sides upwards. When it comes to lifting this lower part, the base of the nose, what most people want is this. For those whose nostrils are too visible from the front, when they try lifting this area themselves, they feel like their nostrils become less visible. Many people ask if this effect is actually possible and if it can be achieved. And in conclusion, if you properly adjust the position for alar base lifting and the amount of skin to be excised, it is possible to some extent to lift the lower base of the nose upward. However, in my experience, the maximum effect you can achieve is about 2 to 3 millimeters. However, depending on the patient, some people experience really good and even dramatic results, while others only see a very subtle effect. Therefore, I strongly recommend that you always consult with your doctor before surgery regarding this matter. Actually, there aren't many plastic surgeons who perform this surgery, so in my case as well, I've been gradually researching and studying this area through various cases. In any case, based on my experience, I've concluded that it is possible to achieve a certain degree of effect in this area, and I'm continuing to perform these surgeries diligently. And now, in this modified version of the alar lift surgery, there is a second effect. Usually when we talk about a dragon nose, it means that the upper part of the nostrils sticks up sharply, like I mentioned before. Even G-Dragon has what's called a dragon nose. There are people whose nostrils are raised, and in fact most of them still want to lower their nostrils a bit to make that area less noticeable. However, there are some people who feel that this area looks too stuffy, so they actually want to lift it up to make it look a bit like a dragon nose, or they want a more open-looking nose shape. That's why there's a saying that patients are the teachers of doctors. This is actually something I learned by thoroughly discussing with patients and building up experience case by case. As I performed a lot of these alar lifting procedures, I gained confidence in the design and the effects, and after trying this approach in surgery, I found that it could create a dragon nose that looks quite natural. So for those who feel this area is too stuffy or want to create a more open nostril shape, I think it would be good to try modifying the nostril shape from the front using this variation of the alar lifting surgery. However, I truly want to emphasize that this particular surgical procedure really needs to be meticulously well designed, thoroughly discussed and planned in advance, and carefully performed within absolutely safe boundaries and parameters. To summarize once again, alar base lift surgery is basically a procedure that lifts drooping nostrils upward, but with some variations, it can also slightly raise the nasal floor attached to the nostrils, and then by altering the shape of the nostrils, it can create a more open and refreshed appearance. With that, I'll wrap things up here. If you have any questions about alar base lift surgery, please leave a comment. I'll do my best to answer them. Thank you.